Thank you very much, and good morning to each of you. It's my pleasure to be here and be part of the committee that's been working on this very important issue. And I just, really want to echo the sentiment that this really is a great time, and there's a lot of opportunity to really advance the work that we have continued to build upon already what's happening around the world. I want to talk today about our third domain, which is the organization domain. And one of the ways in which I kind of think about this is the belief that success in achieving health equity is dependent upon us addressing the social determinants. In order for us to educate providers about the social determinants, it's important that we also think about the role of the organization. And as you'll read in the committee, when we talk about organization, and similar to our definition of health professions, it's a broad definition of who we're focusing on with regards to organizations. It's not just the educational institutions in which the learning may be taking place or the communities in which we're partnering, but it's also a broader definition of governments, other organizations, non-governmental organizations who all have a role in making sure that we're aligning our policies and programs to support the incorporation of social determinants of health education. So the components of our organization domain, as you heard earlier from Dr. Fisher, are two parts. We have a vision for and a commitment to the social determinants of health education. And what we talk about when we mean this is aligning our policies, strategies, programs reviews, making sure that we're providing resources to actually educate providers about the social determinants of health, as well as to support community partnerships so that they are able to participate in this, that we have an infrastructure in place that includes the ability to support that, and it's infused as well in our promotion and career pathways. As Dr. Magana mentioned, we don't see a lot of evidence base with regards to social determinants of health, and really thinking about how do we support and incentivize the rewards for publishing about the myriad of work that's already ongoing in this area is critically important to building that evidence base to make sure that we have that, but that also we reward the providers, the faculty, the students as well in learning through this and creating those transformative environments. The second component is that supportive organizational environment. And again, as we've talked about, we really think that transformative learning is critically important in this. It's lifelong learning, so that can happen throughout an individual's life as they are both in the community, in formal education, and back out practicing. But we are disseminating as well the research and our findings. We have the support of the faculty development and continuing education as they move forward in their careers. So how do we make sure that as we are creating this environment that it really from stem to stern is supporting the incorporation of social determinants of health education? So with that, we've come up with this recommendation. And as you can see, we are looking to make sure that governments and individual ministries, health professional and educational associations and organizations and community groups should foster an enabling environment that supports and values the integration of the framework's principles in their mission, culture, and work. To do that, we encourage that these organizations look to review and map and align their educational and professional vision, mission, and standards to include the social determinants of health as described in the framework. That we, again, are aligning across the board these efforts to make sure that this is a fundamental part of what we are doing. So what does success look like? They can demonstrate success and support for this through some of these following actions, such as producing effectively and disseminating case studies and evaluations, working with relevant government bodies and to support and promote health professional education and funding for those opportunities, planning and other investments, as well as introducing accreditation of health professional education where it doesn't exist and strengthening it places where it does, continuing professional education development programs, as well as supporting experiential learning opportunities. There are a number of other things that could be incorporated in this, but as we think through the work that we have, these are some of the places where we can start to build on the work that's already ongoing across the world as we incorporate social determinants of health. And by doing this, we can, I think, through that, get to a place where we have a very strong foundation to build upon and are working to achieve our goals of health equity through the partnership and promotion of the social determinants of health. Thank you.